Good afternoon, Jose. How are you today?
I'm good, thank you.
Good, good. Thank you so much for allowing me to record this portion of our interview.
Not
So
good.
I would love to go ahead and get started. So why don't you tell me about your experience? I understand you were the secretary slash reception at
Yeah, yeah,
Larkin Community Hospital, and
definitely.
how has it prepared you for the role that we talked about?
Honestly, because I've worked with a lot. I mean, I worked in Hialeah, so I've worked with a lot of like Latino people. So basically, I've helped them a lot, and my thing is just I like helping people, and I feel like reception is very important in the business or whatever because it's the first person you see when they come in. So you got to come with positive attitude, positive mindset, and just basically make the customer or slash medical at the time I was working the patient have a great time. Nothing about nervousness. Because at the time I was working in the ER, in the emergency room. So like a lot,
Oh,
yeah. So like a lot of medications, a lot of medicine. Like you see things there, and sometimes the patients get scared, but you have to like calm them down. Because I was
okay.
the first person they saw, so I'll basically calm them down with a positive mindset, positive atmosphere. Sorry.
Okay, great. And what were your specific responsibilities that you had? Like what did your day look like? I'm sure in
Oh,
the ER it was different every day, but on a
yeah.
typical day.
On my job or at the job or just a normal typical day for me?
Oh, no, at the job, at
Oh,
when
okay,
you
okay.
were the at Larkin. What
Yeah.
what did a day look like for you?
Basically, I worked overnight at the time, and basically, just with like calling, like the doctor would tell me what insurance the patient have. We would call the insurance, make sure it's the real insurance. Sometimes they didn't have insurance. We'll probably charge them personally from the hospital, and then they'll owe the hospital money. But mostly, just I'll tell the doctor tell me what insurance the patient has. We would call the insurance, or sometimes if we need to transfer a Baker Act patient, basically, Baker Act patient we would transfer him to from our facility to like Palmetto or like Larkin South or Larkin North in downtown Miami, stuff like that. Because at the hospital they didn't have the Baker Act program anymore. So yeah, basically transfer, call ambulances, call in the insurance, transfer
Mhm.
them, stuff like that.
Okay. And what type of skills do you think you gained at that job?
A lot of patience with people, patience with patients,
Okay.
uh, basically, and also like different atmospheres, different backgrounds. I worked with different backgrounds of people, so it kind of made me more patient with more people, and more responsive to people.
Okay. What about multitasking? Did you have to multitask in that role?
Yes, a lot.
Mhm.
Basically, call the like one time I have to call the insurance, two insurances for two patients, and call an ambulance for a Baker Act patient because we were transporting him to Larkin South.
So, how did you stay organized?
I mean, I have a notebook. I mean, there's a computer on the screen I was working with, and then they had patients in each room. I'll have like a notebook. Always have a notebook with me, and write the patient's name, their date of birth, their insurance, if they're a male or female, their last four digits, their social, stuff like that, and just like I have it very organized. So then every time
Okay.
like they'll leave the facility, the hospital, I'll just scratch their name out and then work my way on the next patients.
Okay, great. And so how do you feel that your education in physical therapy has influenced your understanding in healthcare and how you approach patient care?
I just like helping people since I was a little kid. My grandma had like a knee infection, and then everybody in the room wanted like to leave because she would like take the bandages off, and then everybody would be like, "Oh, disgusting," like. But I will be there for her. Like I didn't mind; she's my grandma. But everybody left. My mom left. Everybody in my family just left the room because they found it disgusting. But me, on the other hand, I stayed there. I helped her. I put warm water on the infection. Even I was like 8 years old at the time, and
Oh,
from then on, I just liked helping people.
okay.
I got a passion for helping people. So yeah.
Okay. And so tell me about your education. So where did you go to school?
I went to Matter Academy High School. Right now I'm still in MDC. I got my associates. Still doing my bachelor's. I'm trying to be a physical therapist, but I might switch to nursing because I feel like nursing is more for me because I want to help. I just like helping people. This is my thing. I just
Okay.
love helping
All
people.
right. Well, definitely got the theme of our call definitely is helping. So I appreciate you sharing that.
Yeah.
Why don't you tell me about any relevant coursework that you've had that helped you with this type of position thus far? What type of courses have you taken to prepare you?
Uh, anatomy, anatomy two, psychology, humanities as well. Get to
Okay.
understand people more.
Okay. And then can you tell me about, this is probably going to go back to the hospital, but
Okay.
about a situation where you had to handle a challenging patient and how you addressed their needs and maintained positive during that
Oh,
time?
yes. So there was a Baker Act patient, very crazy, very hands-on, very violent in the ER. None of the nurses didn't know how to handle them because they were Latinos. So like Latinos, they were another Latino. They kind of like shout and stuff. So I basically got the nurse that was with the patient. I got the patient, and then I settled them down very nicely. Hey, this is not you shouldn't talk to the patient like that, and then the patient shouldn't talk to the nurse like because we're trying to help you. We're trying to make you better. And
Mhm.
basically, I calmed them down. They both calmed down, and then I gave him a sandwich because the ER didn't have food, so I gave him a sandwich, a juice, and basically the Baker patient calmed down. He fell asleep, and then we transported him then from Larkin South. By the time like I had to get both the nurses down and calm them down because the nurses were kind of like being aggravated because the patient was like being like violent because he was Baker Act, and I basically both calmed him down. I talked to the Baker Act patient like a normal person, and he calmed down. And then yeah, and then from there I gave him a sandwich, and then he went from Larkin South. He got transported to Larkin South.
Okay, great. And then you mentioned Latino. I understand you speak
Yes,
Spanish
ma'am.
and English.
I'm Colombian. I'm Colombian Dominican. My mom's Colombian and my dad is
Okay.
Dominican.
Okay, great. So you're comfortable speaking with patients in English
Yes,
or
ma'am.
Spanish, and you can
Yes, ma'am.
read and write in Spanish
Yes,
and
ma'am.
English? Okay,
Yes, ma'am.
terrific. And then how about that job was a pretty busy job that you
Hmm.
had, of course, at the hospital. So how do you feel that you would fit in, like in a doctor's office in a calmer environment? Do you feel like
I
that's
feel
a
like I'll be
good,
great. I feel like I'd be
yeah?
great. Yeah, it'd be great.
Okay. Like answering calls and helping patients schedule appointments and such. Do
Yes.
you feel
I
that you
I
are
actually and I
detailed?
yes, I actually honestly did that as well, Larkin. I will actually schedule patients for like for the insurances or like the next time they need to come in to visit. I was basically schedule them for like a surgery or something like that, and they'll come in.
Okay. Okay. So you did insurance verification as well
Yes, ma'am. Yes,
in
ma'am.
that position. Anything else that you were doing in that job maybe that you didn't think about when I was asking you before?
Uh,
So insurance verification, you did
insurance
scheduling.
verification, helping patients. I mean, there's one time that a couple of times I gave them medicine from but the doctor told me to give it to him. So he
Okay.
gave me the medicine, and then I went to the nurse and I gave the medicine to the nurse, and the nurse would like give him the medicine stuff like that.
Okay. All right, great. So, as far as the position that we've already discussed,
Hmm.
I feel that you definitely have the skill set and the experience for this position. So, I'm going to go ahead and stop this part of the recording, but don't go anywhere because we've got
Okay.
a few more things to chat about.
No, it's okay.
Okay,
It's okay. It's
thanks.
okay.
Thanks, Jose.